Hello, ladies and gentlemen. Welcome back to Boondock Medicine. I'm Doc, and this is Punky. And Beauregard's down here licking himself for some reason. I'm not sure why. How are you folks doing? Hopefully you're doing well. It's starting to get cold outside, and it's time for us to head south. So we will do, at some point, I'll do a tour of my rig, and my rig is set up for boondocking. And so specifically for boondocking. So at some point I'm going to get my friend, my editor, and we're going to do a video on my rig and how to set up for an actual travel trailer to set that up for actual boondocking. If you don't know what boondocking means, it means going out in the middle of nowhere and being self-sufficient, under the radar. Have a nice day. Okay? All right, but today we're on the medical side of the house again, and we're going to talk about something that even I suffer from, and that is hay fever. Most of us, we can't wait for spring and summer, and even fall has its enthusiasts. The scent of new mown grass, I love that. Flowers, and even the smell of dead leaves in the fall. But those of us who suffer from hay fever, these seasons make us cringe. The sight of used tissue, sounds of sniffling, and the distress of watery, itchy eyes makes us wish for winter again. It's incredible. Some unfortunate individuals are plagued with these symptoms year-round, if you can believe that. Medical professionals call this perennial allergic rhinitis. That's right. Let me say it again. It's perennial allergic rhinitis. Hay fever has become more common worldwide among all ages. 1 in 5 persons has hay fever. 1 in 5 has hay fever. Okay, let's talk about supplements. Coenzyme Q10 is a good thing to take. 30 to 100 milligrams per day. Vitamin A, 100,000 international units per day for 1 month, then reduce it to 25,000 international units per day. Oh, by the way, this is my buddy Punky. Punky, what are you doing? This is my buddy Punky here. He's my friend. Bo is right here. So Punky's sniffing me for some reason. Vitamin B complex is 100 milligrams per day. Good for you. Vitamin B5, 100 milligrams twice a day. Vitamin B6, 2 milligrams twice a day. Vitamin C, again, we talked about vitamin C a lot. 1,000 to 3,000 milligrams per day helps a lot. Zinc also helps a lot. Remember, hay fever is basically an anaphylactic reaction to your surroundings. Anaphylaxis, that means you're allergic to it. So there's really not a whole lot you can do about it if you have to breathe, which we all have to do. So let's talk about herbal remedies. Stinging nettle. Stinging nettle sounds nasty, doesn't it? You don't want to sit on it. In my patients, it works better than their conventional medications. Typical dosage is 300 milligrams of freeze-dried nettle in 2 capsules. They're in capsule form, so you don't have to worry about getting stung 2 or 3 times a day. Excuse me. Peppermint. Peppermint's great stuff. People don't understand peppermint. Inhaling peppermint's volatile oils can help you breathe. It's just the way it is. One study found that both menthol oil extracted from peppermint and peppermint oil have anti-inflammatory benefits. So steep 1 tablespoon of the dried herb in one hot, make tea out of it and drink as needed. If it helps your symptoms, great, and it should. You can also use essential oil of peppermint in steam inhalation if you got one of those steam inhalation machines. You can use the essential oil. Now that comes in a little bottle in droplets. Most of you know what that is all about. But you can throw that in there and start breathing that. Don't use peppermint, however, internally if you have heartburn or esophageal reflux. It's not good for that. It's gonna enhance that. Licorice root. Licorice is another herb that people, people don't know anything about, but it's excellent stuff. It's an anti-inflammatory. It's an anti-allergy. And licorice has actions that are similar to some cortisone drugs, believe it or not. Hydrocortisone, good steroids. There are two kinds of licorice. For hay fever, you want whole licorice, not the DGL variety, okay? So whole licorice is what you want. Typical dosage is up to 600 to 500 milligram capsules. Again, you can get them in capsules. Or 20 to 30 drops of the tincture twice a day. You can get it in a tincture form. And again, a caution: don't use licorice for longer than 6 weeks. Don't use it if you are pregnant or nursing. Remember, if you're pregnant, everything you take into your body, your baby gets. Okay, your fetus gets. Everything you do, your fetus gets. Smoking, drinking, taking antibiotics, the fetus gets it too. All right, just remember that. If you have high blood pressure, don't take it because it elevates your blood pressure. Diabetes, thyroid, kidney, liver, or heart disease. Also, if you're already taking corticosteroid allergy meds, consult your practitioner before adding licorice to your treatment regimen. That's how strong licorice is. That's how effective it is. Feverfew. Best known for preventing migraines. Those of you who have migraines, I'm sorry for you. I have a couple of friends who have migraines, and I understand what they go through. Many herbalists view feverfew as an anti-allergy herb too. You can chew on 1 or 2 fresh leaves each day, but the bitter taste will drive you to the liquid or the capsules. Again, in liquid or capsule form, you can take it. Typical dose up to 4 to 500 milligram capsules every day, or 15 to 30 drops of the tincture. Again, the tincture is bitter. There's no getting around it. It's bitter. But you want to take 15 to 30 drops of the tincture QD. And how do you take a tincture? You can dilute a tincture if you want to, or typically tinctures go underneath the tongue because underneath your tongue is very vascular and picks up the vascularity underneath your tongue picks up all of these tinctures and will give them to your body quicker than anything else. Caution again: patients allergic to members of the daisy family. If you're allergic to the daisy family, and you may have allergic reaction to feverfew. Do not use during pregnancy. Again, don't. Garlic's great stuff, guys. Garlic is really good stuff. Again, I'm one of those crazy people that drink the brine from dill pickle because I think it tastes good, it's refreshing, and it has a heck of a lot of garlic in it. Garlic's great for you. My favorite spice contains an anti-inflammatory substance, quercetin, which can help calm the allergic response during hay fever season. Garlic is a potential antibacterial, or a potent antibacterial, and an antiviral agent too. So it may help ward off sinusitis, which is an infection of your sinuses or inflammation of your sinuses, and make your mucous membranes less of a target for opportunistic bacteria and viruses. So garlic is good stuff. Good stuff. And you can take it a bunch of different ways. Total dosage, 500 to 600 milligrams per day. Look for products that deliver at least 4,000 to 5,000 micrograms of allicin. And allicin is the what you want to look for. Allicin is the primary product in garlic that is beneficial to us. Consult your doctor before taking garlic if you have stomach inflammation, if you take blood thinners, or expect to have surgery soon. Okay? Reishi, an ancient Chinese herb which has several benefits, including the ability to reduce allergies. Reishi inhibits some of your internal chemicals that trigger histamine inflammation. In China, it's used to treat asthma and other allergic diseases. Typical doses is up to 5 to up to 420 milligram capsules per day, or up to 3,000 milligram tabs twice a day. And the last thing is local honey. Local honey is great. Make sure it's local honey, though. Make sure the honey comes from a local farm. Honey is not regular honey. Bee honey is known to reduce your histamine exposure during hay fever season, but it takes a little time for your immune system to respond. So you have to start taking it. Also, the local pollen may be even more beneficial. You can sprinkle the pollen actually on your cereal in the morning. You could throw it in your tea or coffee, and it really helps your immune system ward off a lot of the local anaphylaxis in your area. The typical dose is put raw honey, like I said, in your tea, coffee, cereal, or in pancakes each morning, and mix a teaspoonful of pollen in as well. Remember to talk to your practitioner before you start any of these herbal remedies. Of course, if you like what he has to say, go with it. If not, do some research and make an educated decision. You're an adult. You've got access. Most of you have access to, well, you do have access if you're listening to me, have access to the internet. So do some research. Always remember, it's your body, not your doctor's. Always, always, always get a second opinion, and maybe a third, especially with regards to your health, and especially regarding any kind of surgery. With winter coming soon, I'll be reverting to my special operations training, and we'll talk about winter survival. And since the boys and I will be in the desert most of the winter, we'll do a desert survival video too. So stay tuned for even more good medical boondock training. And it's about time for us to get the heck out of Oregon and California. If you like what we're doing, please subscribe. Doesn't cost a thing. And see you next time on Boondock Medicine. Alpha Mike Foxtrot. Out.